Stroke complications in young people, an unexpected danger sunny day. Hi everyone, today we're going to learn about a very important and alarming issue, which is the complications after a stroke in young people. More and more young people are facing this dangerous disease, and what's even more worrisome are the potential complications that follow. Let's learn about these complications together, their severity, and how we can prevent them. First, we'll talk about the complication of brain swelling and edema. This is a very dangerous condition after a stroke. When the brain is injured, it can swell, putting pressure on the surrounding brain tissue. This can lead to many serious problems, including difficulty walking, moving limbs, and even vision loss. Imagine you're young, full of ambition, but suddenly you face difficulties in walking and doing daily activities. It's really difficult. Next, we'll discuss the complication of pneumonia. It doesn't sound very related to stroke, does it? But in reality, after a stroke, patients often have difficulty chewing and swallowing. This makes it easy for food and drinks to enter the airway, creating an opportunity for bacteria to attack and cause pneumonia. Pneumonia is a very dangerous complication, especially for those with weakened immune systems after a stroke. Did you know that stroke and heart attack are closely related? In fact, many stroke cases are related to cardiovascular problems, especially atherosclerosis. When arteries are narrowed due to plaque buildup, the risk of a heart attack increases significantly. Therefore, controlling cardiovascular risk factors such as blood pressure and cholesterol is extremely important to prevent both stroke and heart attack. Besides the physical complications, stroke can also leave severe mental and emotional after effects. Depression is one of the common psychological complications after a stroke. Imagine you are young, active, but suddenly you have to face limitations in health, mobility, and communication. It can make you feel hopeless and lose faith in life. Therefore, psychological support for stroke patients is essential. Another very common complication in stroke patients is ulcers and necrosis. Due to paralysis or limited mobility, patients often have to lie or sit in one place for a long time. This causes the skin to be compressed, lacking blood supply, gradually leading to ulcers and even necrosis. Skin care for stroke patients is very important to prevent this complication. Cognitive decline is a fairly common complication after a stroke, especially in older adults. This complication can affect memory, concentration, thinking, and language, making it difficult for patients in their daily lives. Cognitive rehabilitation for stroke patients is very important to improve their quality of life. Epilepsy is a complication that can occur after a stroke due to brain damage causing abnormal seizures. These seizures can be very dangerous, especially when they occur suddenly and are not controlled. Treating epilepsy after a stroke is essential to prevent further brain damage. Limb spasticity and shoulder pain. After a stroke, many patients experience limb spasticity and shoulder pain. This is due to brain damage affecting the nerves that control muscles. Limb spasticity and shoulder pain can make it difficult to move, walk, and even perform simple daily activities. Physical therapy and rehabilitation are very important to improve this condition. Blood clots. Blood clots, especially deep vein thrombosis, are a dangerous complication that can occur after a stroke. Because patients have to lie or sit in one place for a long time, blood circulation is difficult, and blood clots can easily form in the veins, especially in the legs. If a blood clot travels to the lungs, it can cause a pulmonary embolism, which is life-threatening. Early mobilization and the use of anticoagulant medications are essential to prevent this complication. Urinary tract infections and bladder infections. Finally, we'll talk about the complication of urinary tract infections and bladder infections. After a stroke, many patients have difficulty controlling their bladder and have to use a urinary catheter. Inserting a urinary catheter can create an opportunity for bacteria to enter and cause a urinary tract infection. Maintaining personal hygiene and changing the urinary catheter regularly are very important to prevent this complication. Protect yourself and your loved ones. Wow, as you can see, stroke is truly a dangerous disease with many potential complications, especially in young people. It's worth noting that many complications can be prevented if we have the knowledge and act promptly. Remember, prevention is better than cure. Don't forget to like and share this video to spread this meaningful message to your friends and family. Remember to follow Sunny Day for more useful information.